Hello students. Today I will be talking about autoimmune disorders. Some we have touched base on already in the semester. Some will be covered in oral path. So this is a general overview of the most common autoimmune disorders that you may encounter in the dental office. So to review, the immune system. It protects us against microorganisms that are always trying to break into our body because we have the perfect temperature and wetness that microorganisms love to live in. The immune system creates antibodies that attack substances that it detects as being non-self. So when it's working correctly, it should be able to distinguish or tell the difference between cells that belong to itself and cells that are different, which we call non-self. So autoimmune disorders happen when the body's immune system reacts inappropriately to its own tissues or organs. And the destruction or the disease process is caused by the formation of something called auto, meaning self, antibodies. So the body starts creating antibodies against itself. Some of these autoantibodies are easily detected by lab tests, and others are more difficult to recognize. So there are some autoimmune disorders that are difficult to characterize as autoimmune yet because the autoantibodies, a lab test is not available yet to detect if that particular autoimmune disorder is happening. So what causes it? It's considered unknown. They're not quite sure what happens. They think there is a genetic predisposition. So autoimmune disorders may run in families, but that doesn't mean that if I have lupus, then my daughter has lupus. I may have eczema. My daughter may have lupus. My son may have Hashimoto's thyroiditis. So the genetic predisposition isn't for a particular disease. The genetic predisposition is that the person or in the family, they have a tendency to have autoimmune disease. They also think that there could be environmental triggers, that you're exposed to certain viruses or exposures to certain chemicals, and that may start a cascade of events that triggers an autoimmune response. And potentially that there is a hormonal component because autoimmune disorders are about 75% more common in women. So the way autoimmune disorders are classified is whether it's a specific organ or tissue that is attacked, or if it's systemic, the response occurs across multiple tissues and organs. So some specific autoimmune disorders would be diabetes type 1, those beta cells of the pancreas, or Hashimoto's thyroiditis, so the killing off of some of the thyroid gland. So here are some facts. Most have no cure. They can disappear on their own, which is rare. They can have periods of flare-ups, meaning the person is currently struggling with the symptoms of an autoimmune disease, and remissions, meaning it's kind of gone to sleep. The person is not suffering from any symptoms of the disease process. Many have chronic symptoms that can, over time, get worse. In the most autoimmune disorders most frequently affect our endocrine glands, our blood components, our connective tissue, skin, muscles, and joints. And how they treat these autoimmune disorders it depends on the tissue or the organ involved. So for diabetes type 1, it would be insulin. Hashimoto's thyroiditis would be a thyroid replacement hormone. They also use drugs that turn down or shut off the immune response. They'll use NSAIDs, that's non-steroidal anti-inflammatory drugs such as ibuprofen at a prescription strength level, and that helps to decrease inflammation. They will also use steroidal anti-inflammatory drugs such as corticosteroids. Corticosteroids in large enough doses help to also turn down the immune response. And then immunosuppressants such as methotrexate and Sandimmune. Interestingly enough, Sandimmune is one of the 3 drug categories that cause the oral side effect of gingival hyperplasia. So you'll have to know that for sure. So how does this impact us in the dental setting? It really depends on the particular disorder. So the impact of the treatment for the disorder, right? Things like, are they taking large doses of NSAIDs? They could have a lot of stomach upset with that. Corticosteroids in large enough doses can kind of mask, because it's also an anti-inflammatory, it can mask progressing periodontal disease. And then immunosuppressants can cause bleeding disorders, and you can see evidence of that in the mouth through petechiae, which is the small pinpoint sort of blood blister, and then a medium-sized one is a purpura, and then the large ones is ecchymoses. Additionally, the person has an increased possibility of infection, so you may see thrush, which is a yeast infection in the mouth, and also gingival overgrowth. So here are the most common, occurring in more than 1 in 100 people. These will cover these most common autoimmune disorders. So psoriasis. So psoriasis is an immune-mediated disease. So what that means is it's a disease with an unclear cause that's characterized by inflammation caused by a dysfunction of the immune system that causes inflammation in the body. But there may be visible signs of this inflammation, such as raised plaques. And plaques will look different for different skin types. So plaques are sort of like thickened scales on the skin. And this occurs because of an overactive immune system, which speeds up skin cell growth. So normal skin cells completely grow and shed or fall off in a month. With psoriasis, the skin cells do this only in 3 or 4 days. So instead of shedding, the skin cells keep piling up on the surface of the skin. So this inflammation may also affect other organs and tissues. Hashimoto's thyroiditis. So that is when the autoantibodies created that attack the self, they attack the thyroid gland. The gland becomes destroyed and results in not enough thyroid hormone, hypothyroidism. This also often results in goiter, this specific hypothyroidism. We learn that goiter is most common in hyperthyroidism, but this unique hypothyroidism, Hashimoto's thyroiditis, may also result in goiter, which is that thickening in the neck. Celiac disease is an allergy or response to substance that contain gluten. So the villi in the small intestine are destroyed over time, and this can result in a malabsorption of necessary nutrients. Graves' disease is an autoimmune response that leads to an overactivity of the thyroid gland. So that is hyperthyroidism. It binds, these autoantibodies bind to the receptor that's responsible for releasing thyroxine, causing it to release more thyroxine. You will see the goiter in the neck, weight loss, heat intolerance, the exophthalmos, this bulging eye that we see right here, and additionally, a very fast heart rate known as tachycardia. Rheumatoid arthritis is when autoantibodies attack synovial membranes. This results in inflammation and it destroys the bone and the cartilage. Over time, joint mobility is lost. It can affect other parts of the body. It usually does begin in the hands. There is a juvenile rheumatoid arthritis that can develop in young children and is 3 times more common in women. These are the second most common autoimmune disorders. We'll only be talking about a few of them. We have diabetes type 1, insulin-dependent diabetes, when the body, these autoantibodies destroy the beta cells of the pancreas, which are responsible for releasing insulin. Glucose will remain in the blood, resulting in hyperglycemia. If the insulin is not there, the glucose is unable to enter the cells. Vitiligo is a skin condition that is due to the destruction of melanocytes. It results in depigmentation of patches of skin, and it may also affect mucous membranes in the mouth. So you may also see these patches in the mouth on the buccal mucosa or the attached gingiva. People with vitiligo also have a high risk of having other forms of autoimmune diseases. Pernicious anemia happens when the parietal cells, these are cells in our stomach, fail to make a hormone known as intrinsic factor. When they do not make intrinsic factor, we're unable to absorb vitamin B12. And vitamin B12 is a critical component in the proper development of our red blood cells. So when you hear the word anemia, you're thinking of low red blood cells. One of the side effects that can be seen orally in pernicious anemia is a very smooth, or sometimes called a bald tongue. Multiple sclerosis is inflammation, scarring, and a destruction of the myelin sheath in the nerves of the central nervous system. Myelinated nerves carry messages to the brain much faster, as the message is able to hop over the myelinated sections. This is called saltatory conduction. When the myelin is destroyed or scarred, the message has to travel the entire length of the nerve. And this means that nerve messages are not transmitted as quickly to the brain. So the symptoms associated with multiple sclerosis vary widely, and they tend to have periods of remission and flare-ups. Here are the third most common autoimmune disorders, happening in about 1 in 10,000 people. And again, we will not talk about all of them, but some of them. Addison's disease is when these autoantibodies attack and destroy the adrenal gland. So the body is unable to produce the adrenal hormones, especially cortisol, the glucocorticosteroid. What is seen in people with Addison's disease is weight loss, muscle fatigue, low blood pressure, but additionally hyperpigmentation. It's not well understood why this happens, but they believe it has something to do with when you're not producing enough corticosteroids, that the body produces excess amounts of melanin, the hormone melanin. And that is why you get the hyperpigmentation. You will need to take replacement drugs to fulfill the need of lack of cortisol. So you'll be taking steroid hormones for the rest of your life when you have Addison's disease. The next two that we'll be looking at are both labeled under inflammatory bowel diseases, or IBD, including Crohn's disease and ulcerative colitis. So Crohn's disease occurs anywhere along the GI tract, from the mouth all the way to the anus, although it's most typically seen in the small intestine. In these sort of this cobblestone look here that we see in the small intestine, the ileum, you could also get this sort of pebbled cobblestone look in the oral cavity with Crohn's disease. So ulcerative colitis is limited to the large intestine and the rectum. So there's inflammation and ulceration along the GI tract. Bullous Pemphagoid is an autoimmune disorder of the skin, but occasionally it can also be seen intraorally, and it attacks the epithelial cells or the basement membrane, and it kind of gives you almost this blistered vesicle look on the skin. Lupus Erythematosus is an autoimmune disease of connective tissue. It attacks the nucleic acid of cells in cutaneous forms, meaning cutaneous meaning skin. It happens a lot on the face. And a characteristic sign, something we observe, is a butterfly rash. So it extends across the nose and on both cheeks. So that's the cutaneous form. There is also a systemic form, SLE, systemic lupus erythematosus, that can affect any area of the body. Myasthenia gravis is when the antibodies that the body creates actually block the acetylcholine, I see a typo here, choline receptors on skeletal muscles. So if the acetylcholine cannot attach to the skeletal muscle receptors, we don't get a lot of muscular contraction. So you can see things like muscle fatigue, swallowing difficulties, ptosis, which is this eyelid drooping here, dysphagia, that difficulty swallowing, double vision, and then the medical emergency that we've discussed in the past, the myasthenic crisis, where you need to be suctioning out the fluids. The person is sort of secreting a bunch of fluids, they're choking on them, they can't swallow them, and they're having difficulty breathing. Scleroderma is the most deadly autoimmune disorder, especially if you get it internally, generalized. It's a thickening, hardening, and tightness of skin, and then internally blood vessels and organs. It causes the body to actually create more collagen. So when you have it localized, you can really get this skin tightening. Sometimes the face will have like a mask-like appearance. But if you get scleroderma internally, like in your lungs, and we need our lungs to be bouncy and fluid, to be pushing air in and out, and you're creating collagen and stiff lungs, that is why scleroderma is the most deadly autoimmune disorder. And then Sjogren syndrome, this is a very drying syndrome. This is what I think. Everything is dry because the autoantibodies attack our salivary and lacrimal, our tear glands. You have extreme dry mouth and dry eyes, and then occasionally the parotid gland. So if we look here, this is the lip, this is the cheek, this is the parotid gland swelling on the side. 30% of people that are diagnosed with Sjogren syndrome will also have a systemic involvement, including the lungs, kidneys, blood vessels, and muscles.